If you're a woman over 60, there's one movement that matters more than anything else for your future. It's your ability to sit down and stand up from a chair because how you do this predicts your future independence. It's incredibly simple, but its impact on every part of your life is huge. If you're like many women that I've worked with, you might be wondering, how could getting out of a chair be the most important exercise for me? And it's a great question because gyms are full of machines and everyone, including your doctor, tells you how amazing walking is for you. But if you struggle to get out of a chair and don't do anything about it, you begin to lose options, including the option to live independently. Struggling at first doesn't mean you've failed. It means this is the movement you need to protect now before it's too late. Because imagine this, you need to get up from your couch to use the bathroom. You go to stand, but you can't because your legs just aren't cooperating. What would you do? Seriously, this is not a good spot to find yourself in, yet far too many women don't think about this until they're stuck. As a home care physical therapist, I've seen way too many children have no choice but to put their mom in a nursing home for the simple reason that mom can't get off the toilet. When you can't stand up on your own, somebody else has to lift you. And that means another person trying to lift most of your body weight, which is both difficult and very unsafe. I've seen children in their 40s and 50s struggling to lift their moms, and having to do this day after day is exhausting, draining, and often leads to injury. No matter how much you want to help someone close to you, you can only lift them so many times before the situation becomes difficult for all parties involved. Helping another person stand is way harder than lifting weights in the gym. And your brain can still be sharp, but if your legs fail you, then everyday life just becomes risky. And while walking is great for your general health, it won't protect your ability to safely stand up in the future. When I see a patient struggle to get up, I know they don't have the requisite strength to safely navigate life. And if you can't navigate life well, you become a fall risk. And when you're already weak and then fall down, well, that never ends well. Think of standing up from a chair like the foundation of a house. If the foundation is weak, it doesn't matter how nice the rest of the house is because the whole structure is unstable and bound to crumble at some point. The best part about practicing this move is you don't need a gym. You can do it literally whenever you want because your house has endless options to sit down and stand up from. The recliner, couch, toilet, bed, even the second step on a staircase can work. But the important part is that you make it a point to be consistent with it, day after day. And remember to start slow, because if you haven't been exercising, it takes time to build up the capacity of your joints and your muscles to handle movement. And if you struggle to be consistent with exercise in general, here's how I recommend that you add these in. Just tie it to something you're already doing in your day. Two simple options are to perform a few reps from the toilet while you're using the bathroom, or practice it after each meal. And don't think of it as a big workout. You won't sweat and you don't need gym clothes. You're just practicing a movement that you're already doing daily, and it's only adding a few extra seconds to your day. I want you to keep in mind that there's three main factors that determine how hard this exercise is going to be for you. The height of the chair, along with how firm it is, because a tall, firm chair will be much easier to do this from than a low, squishy couch. And if you struggle to get up from a low chair, just add a pillow or two under your butt, which will also make it easier, or you can use your hands to push off until you get stronger. And just like the chair height changes the difficulty, your own height matters too. If you're 5'10" with long legs, this move will be way more challenging than if you're 5'2" with much shorter legs. But no matter your height, this move is modifiable and can work for anyone. Once you feel comfortable with your own body weight, here's how you're going to make it more challenging. And by comfortable, you should be able to do 30 in a row, which almost anyone can get to with just a few months of practice. From there, you can either stagger your feet, which will bias one leg at a time and make it more difficult, or you can add weight if you have it. And because of the increased difficulty with these new variables, you'll have to reduce the reps, which is exactly what you want to be doing in this scenario. Before we talk about tracking your progress with this, let's address a question I get all the time. And you might be thinking that this sounds great, but you can't do it because your knees hurt to squat. Here's a couple tips to keep in mind if that is the case. Number one, start slowly and from a raised height. Most people with knee pain can tolerate this movement if they start from higher up. And number two, focus on sitting back versus letting your knees go forward when you do it. Because if you can't tolerate squats right now, focusing on sitting back can reduce stress on your knees temporarily. And if you continue to deal with knee pain, this is something that should definitely be addressed with a more in-depth strengthening program. If you avoid squats forever because of knee pain, you're setting yourself up for long-term weakness, which is not what you want. So how do you know if you are getting better at this? There's a simple test I use with most of my patients. It's the 30-second sit to stand. You're going to sit down and then stand back up as many times as you can in 30 seconds. Make sure to use the same surface each time for consistency. And you want to keep your arms crossed over your chest just like that. It doesn't matter how many reps you get the first time because everybody has to start from somewhere. What does matter is that you're working to improve over time and tracking your progress. Try it today and write down your number on your phone or somewhere else. Retest yourself every couple weeks to see how you're doing. In a few months, you're going to be shocked by how much progress that you've made. Patients often ask me, what's the most important exercise for me to do? Is it walking? Or what about those pedal bikes I can do while I'm watching TV? I tell them it's neither. It is the sit to stand. Because if you don't stay strong at this, you won't be walking because you can't even stand up. And although it might seem too simple, this move alone has changed the lives of many of my patients and clients because simple is what works. And if you think it won't work, I challenge you to do it daily, build up your reps slowly over time, and see how much stronger you can get in a couple months. Because this isn't just an exercise, it's protecting your freedom.